experiences. This is about the first time really that I'm teaching and I have slides. Typically, I just talk like a newscaster, but this topic is tough. So we will go ahead and share slides now. Okay, let's try and make that bigger. Good. Okay. Our topic today is U.S. community pharmacies as vaccination centers, a template for Nigeria in COVID-19 pandemic and other times. I'm your presenter today. Our objectives are as highlighted here. The COVID-19 pandemic and vaccines, we'll discuss that briefly. We would discuss the past and emergent roles of pharmacists in immunization delivery and vaccination goal attainment in America. We'll talk about the need for pharmacists in achieving herd immunity. We will take a look at the SOPs, storage and handling of vaccines, including cold chain understanding. We would also look at setting up vaccination sites. We did mention herd immunity, setting up vaccination site for mass vaccination, as well as local small pharmacy vaccination sites. And then we'll try to go over and discuss best practices for pharmacy-led immunization. So let's start by taking a quick overview over COVID-19 pandemic. As we all know, the pandemic has been with us since December of 2019. I think it crept into the world in Wuhan at about that time, killing people at the wet market, and people were dying, but they never could find out what was wrong with them. They all came down with upper and lower respiratory tract infection symptoms that looked like start like a common cold, and all of a sudden, before we knew it, it was like the whole community was being wiped out. And what we've discovered in December was the city of Wuhan was being shut down. And the World Health Organization stepped in. We could have known about this a lot sooner in America, because America does have its investigators attached to the CDC and the FDA in various hot centers in the world. But our last president was kind enough to recall those people before this pandemic started. So there was no heads up to alert the world that something was going on. It took until January of 2020 before the World Health Organization could declare that as a public health emergency and also a pandemic in 2020. Once a situation is being defined as a pandemic, it brings all the resources of the whole world together to fight that particular opportunity. You can remember a few years ago, it was Ebola in Africa. And it's looking more now like every 10 years, there seems to be a novel virus or a novel infection that is coming around everywhere you go. So we as pharmacists need to be very ready to participate and contribute our quota in bringing about the arrest of any pandemic that comes up, and also to help bring service to all the people that are depending on us. As at 18th March of 2021, more than 121 million cases have been confirmed, with more than 2.68 million deaths attributed to COVID-19, making it one of the deadliest pandemics in history. I think Ebola at its peak took about 3,000 people. But here in America, we are looking at about 550,000 deaths from COVID-19. That is a whole lot more than all the deaths in World War I, World War II, the Korean War, and all of those wars. And if you die back 100 years ago, it was about the same thing with the Spanish flu, that people died like that, 1 million, 2 million. Unfortunately, human behavior seems to be the only constant. because now we have better medicines. Now we have better diagnostic equipment. Now we can easily track and try to control the diseases. But human behavior, as you see, people refuse to follow public health advice, is the reason why we're having so many people die of this disease. Let's talk about transmission. The virus spread through the air, is airborne, and it happens when people are near each other. And this is why we speak to that advice that you should not be in crowds, you should stay 6 feet away from people. When it leaves an infected person, as they breathe, cough, sneeze, or speak into another person, via the mouth, nose, or eyes, or all these membranes, the virus can easily jump onto that. It may also spread via contaminated surfaces. That is why we advise people to make sure you wash, make sure that you clean, you alcohol wipe everywhere, so that there's no space for the virus to grow. The virus remains infectious for up to 2 weeks and can spread even if people do not show symptoms. You've heard when we say people are in carrier state of the virus. Signs and symptoms actually mimic what I said earlier: upper respiratory tract infection and also lower respiratory tract infection. Typically, there's headache, there's loss of smell, taste, nasal congestion, rhinorrhea, runny nose, cough, muscle pain, sore throat, fever, diarrhea, breathing difficulties. You would think that all you're getting is a common cold, but in reality, there are 3 common clusters of symptoms that begin to tell you that this is very serious. One is the respiratory clusters of symptoms we mentioned up there. There's a musculoskeletal symptom cluster with muscle pain, joint pain, headache, fatigue. And then you have a cluster of digestive symptoms, which may be abdominal pain, vomiting, and diarrhea. By the time you're approaching loss of taste, loss of smell, and when you check your oxygen saturation, you are below 90, that calls for some concern. Most people develop mild to moderate symptoms with this disease. 14% develop severe symptoms, and about 5% suffer critical symptoms, which may be respiratory failure, shock, multi-organ dysfunction. These ones are the ones that eventually end up in hospital. We'll take a look at the treatment. Right now, there's no specific effective treatment for COVID. The cornerstone of management is supportive care, which includes treatment to relieve symptoms. We have fluid therapy. You might feel like you're flushed, you're dehydrated. There's oxygen support if you can't breathe. It's not atypical that oxygen is ordered from pharmacies to patients at home in this climate. And when people are in the hospital, they can't breathe, we put them in a prone position. The prone position is turning the patient on their stomach. They lie on their stomach. This way, they are able to breathe better. There are some hospitals that have actually shown that when you trump people early into this prone position, there's a high chance that they come out of respirator much earlier, and the chances of them surviving that is a lot better. As we said, most cases of COVID vaccine are mild. Supportive care medications such as Tylenol or paracetamol or NSAIDs to relieve symptoms, fever, body aches, cough, proper intake of fluids, and we try to make sure that the nostrils are clear for breathing. Good hygiene, personal hygiene, and a healthy habit are also recommended. And this is why you see people always tout that you must take your vitamin D, your vitamin C, your zinc, and all of those. It's good to have all those things. The science is still out there, it's not conclusive. And for those who suspect they are carrying the virus or they've come in contact with somebody who has contacted the virus, we advise that they isolate themselves at home, wear a mask, and gladly, most people do get better. Now, people with more severe cases may need treatment in hospital. Over here, there are some hospitals, they just concentrate on using budesonide, which is a steroid, inhaled steroid. Sometimes they may want to use Atemra, which is a TNF alpha 1 drug that helps to combat cytokine storm. That is when your body system is fighting all over you. We also have mechanical ventilators. We have 2 monoclonal antibodies, okay, that help your body make antibodies against the virus. They're available here in the US. The drug Remdesivir it was also used for Ebola at the beginning. It's available here as well, but recent reports have shown that its efficacy is very, very limited. So this brings us to how can we control or overcome the COVID pandemic. The only option that we seem to have, which was the right one, is to develop a vaccine. And we're glad to say that now we have about 12 vaccines in the whole world. There are only 3 that is being touted here in America. And I think there's the AstraZeneca out in the UK. There's the Sputnik out in Russia. The Chinese people have theirs. I think the Vietnamese people are coming out with one soon. It is our hope, and we know because of the human capacity that is in Nigeria, if Nigeria puts its mind to it, it can actually develop its own native vaccine. So what is a vaccine? A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. It typically contains an agent that resembles a disease-causing microorganism, or is often made from weakened or killed forms of the microbe, is toxin, or one or more of its surface proteins. And these vaccines, you will see them in a vector-based vaccine. You will see some that the new ones, the mRNAs, these are the surface proteins, and so many types of vaccines that are developed based on the way they want them delivered. These agents stimulate the immune system to recognize the agent as a threat, destroy it, and to further recognize and destroy any of the microorganisms associated with that agent that it may encounter in the future. I remember when I was in Ife, Professor Olami Kora he gave us an examination in microbiology, pharmaceutical microbiology, and asked us to explain why the Europeans that came to Africa develop and die of malaria very often, unlike the natives. And it was only after I think I flunked that exam, but I came back for a receipt and passed it, praise the Lord. It was after that that I now realized what we call secondary immune response, which is the ability for the body to recognize the antigen once it has been infected with it before. And that is what we see with all vaccines. A second explanation of that is most people are getting 2 shots vaccines here in America. The first one you get primes your body for it. It gives you about 60% coverage. The second one you get, your reaction to that might be very, very elaborate, much different from your first one, because now your body recognizes the same antigen that invaded your body 2 weeks ago, and there's a fight to make sure that you overcome that. Again, vaccines could be prophylactic or they could be therapeutic. Like I said earlier, we have many vaccines in phase 3 trials. Phase 3 trials are about that time where the population that's being tested is in the tens of thousands. And we've passed the phase 1 where it's all about whether it is safe and whether it is effective. By the time a drug gets to phase 3 trial, that is when emergency use authorizations are given so that the vaccine can now begin to be used in the population. As you may have heard, some people have this hesitancy concerning these vaccines, thinking that these things were rushed. that the science was rushed to push all these vaccines into the market. Unfortunately, that is not true. What we've seen is from vaccine candidates, even before phase 1 starts or at phase 1A up until phase 3, a process that would take about 15 years is now being collapsed into a few months. And the reason why it took that long was because you have to build the infrastructure, you have to build the facility, you have to look for money to pay for the production. Now, the government has thrown its weight behind all those things and collapsed all that time to just 9 months, such that now you can hear Johnson & Johnson say, hey, we have a candidate, and within 9 months, they're already in the market because they don't have to look for money to make the vaccines. The government, I think it was only last week, the US government bought another 100 million doses, Johnson & Johnson. And that means 100 million Americans will be vaccinated and not 50 million because it's a one-shot dose. As at March 2021, I said there are 12 vaccines that are authorized by at least one national regulatory authority. Here in America, we have 2 mRNA vaccines, mRNA vaccines, messenger RNA. These are the Pfizer-BioNTech vaccine. In fact, that is the one that I took. And this is my vaccine card. In my pharmacy, I have been fortunate to have been selected as one of the few pharmacists to participate in working with the government to issue vaccines. And what they sent to me here was Moderna vaccines. That's another mRNA vaccine. There are other vaccines. In America, the other one that we know is the Johnson & Johnson vaccine, which comes as a viral vector delivery vaccine, in which case a cold virus, part of the corona virus, it's adenovirus 26, is used to deliver genetic messages into the human body to trick it to make spike proteins of the corona vaccine, the corona virus, from which the body then reacts and make antibodies. As you can see here, this is one of the, where is it? Where do I, okay. That is one of the vials of the Moderna vaccine that I have given in this store. So let us now discuss what has the US done to involve pharmacists in meeting goals of immunization, vaccination in the community. What are the relevance of community pharmacists, hospital pharmacists, even pharmacists in administration in helping to meet this very important goal of primary health care, vaccinating children and vaccinating adults as well. Typically, children are vaccinated out of their pediatrician's office. We hardly ever have to see them getting vaccines in the pharmacy. Pharmacists push or advocacy to vaccinate actually started around 1995. That was a few years before I got here. But we've pushed on and on. Initially, we couldn't vaccinate people less than 12 years old. And there were only a few vaccines that we could do. But now, because of the corona, a PrEP, which is an emergency authorization by what you will call the Minister of Health or the CDC and the FDA, allowed us now to vaccinate even children, because even children cannot go to doctor's offices because doctor's offices are now they do everything through telemed. You can't throw vaccines through the internet. And the only accessible place that people could go now are pharmacies. So now we're able to administer vaccines to children 3 years and above, as well as adults. As we all are seated here today as adults, I can assure you that there are some vaccines that we should be taking to prevent vaccine-preventable diseases that we haven't taken. Some maybe because of a lack of knowledge, some maybe because we didn't think it's necessary, but we found out that in the United States, the rate of adult vaccination is really suboptimal, whereas compared to children who are typically in the 90% or higher. And we've studied this discrepancy, and we've tried to find out which way are we going to use to improve compliance with immunization recommendation and patient access to vaccinations. I've discussed access earlier, and I've discussed compliance. These barriers, they really abound and affect vaccination rates for adults. A lot of it has to do with a lack of public awareness regarding the need for vaccines and the ongoing threat of vaccine-preventable diseases. And there's also challenges to people paid when they administer these vaccines, because for us, firstly, I'm a pharmacist, very close to that, if not even first, I'm a businessman. You have to pay me for me to continue to remain in business. So pharmacists are ideally positioned to overcome some of these barriers that we've mentioned. So value of pharmacists in vaccination. If I go back, in about 1995, there were barely 20,000 pharmacists that were actually trained to vaccinate in the whole of America. As I speak to you today, there's hardly any pharmacist in America that is not trained or certified to be an immunizer. In fact, if you apply for a job and you don't have a certificate to immunize, it's very unlikely that you'll be hired. Because in America, most of our pharmacies, the big ones, I used to work for CVS pharmacies. Those guys have about 12, 13,000 pharmacies in the country. Walgreens has about 9,000 pharmacies. Walmart comes next, about 5,000. Rite Aid comes next, about 4,000. And all of these pharmacies, really, once you leave the store where the pharmacies are working, the next people you see up there are business people. They're looking at data. They're looking at numbers. They're looking at gross profit. They're looking at every line item. They're looking at every department. How can we make more money? So for them at that level, they're looking at vaccinations as a department that guarantees them good income. So because of that, every pharmacist that they hire must be ready to participate in vaccination program. I'll give you some numbers here. We were vaccinating Moderna this week, and that's a 2-shot dose. The government actually provides the vaccine to us. We don't buy it. They provide the vaccine to us, and they provide all the ancillary products we need with it. That includes syringes, that includes alcohol pads you use to wipe that place. It includes a Band-Aid you put on it. All of those come. The only thing you do as a pharmacist is receive that stuff. You get the patients in, you review risks and benefits with them, you vaccinate them, you put that in the state vaccination collection agency where we put all the records, and the state pays you for the administration that you've done. Put in some numbers here. For the first shot that we give, the state pays you $16 per shot. By the time you give the second shot, the state pays you $28. So we're looking at $44. That was about 2 weeks ago. Now they've moved it to $40 a shot. So if I can give 1,000 shots a month, you can imagine now I've transitioned from being a pharmacist to a businessman. If I can give 1,000 shots a month, that is $40,000. Put margin of error, even 10%, that's $36,000 a month for what I don't have to invest anything in money, in inventory, in staffing. It's just straight, easy money. It comes. So let's get back to this. Pharmacists, what are the value of pharmacists in vaccination? Pharmacists are accessible healthcare providers. I mean, we're the most accessible healthcare providers. If you go to any pharmacy, you don't have a receptionist that will tell you, hey, sit down over here. Let's take your blood pressure. Let's take your temperature. Before you see the doctor, you sat down there for about 2 hours. And the kind of people that we are, time is money. I can't afford to sit anywhere for anybody for 2 hours, just wasting my time. But pharmacists, the guy comes in, he looks at you straight off the shelf, you're talking already, you've taken care of it. Now, because pharmacies are accessible healthcare providers, they can dramatically improve administration of vaccines where vaccines at the moment are underutilized, particularly among adults and high-risk individuals. We also provide education about an access point for vaccination services. Patients often want to know why they need to take their vaccines, and we pharmacists provide that education. So this challenge that has created widespread interest in role of pharmacists can play in creating and implementing measures aimed at improving the administration of recommended vaccine and ultimately stopping vaccine preventable diseases. Right now in America, up to 50,000 adults die every year because of vaccine preventable diseases because they fail to take their vaccines. So let's continue on the values. More pharmacies than ever are offering vaccination services, increasing the number of providers and access points. In this situation where we find ourselves with COVID, there would not be enough doctors' offices to vaccinate everybody, but there are more pharmacists than doctors, than hospitals, and the access we provide as well. 90% of Americans live within 5 miles of the pharmacy. My pharmacy is here. I wish I can show you. Next to me is a very massive hospital. They've got a whole lot of patients over there. There are about 100 doctors' offices all around me, of which about 30 of those people are Nigerian doctors. And right all around me is at least 3,000 to 4,000 people that live within 4 or 5 miles to me. It's the same thing too, even in rural environments where pharmacists are the closest to patients. The other thing we do as well is most doctors close their offices at 4 p.m. In the next hour or so, they'll be done. But we are here till about 7 p.m. We are also open on Saturdays. And if you go to the big stores like CVS and Walmart and Walgreens, they open 7 days a week, including holidays, and they open sometime 24 hours. So what do patients say to all that we've discussed about the value of pharmacists in administering vaccines? We ask them, in receiving vaccination in a pharmacy compared with a physician office or other traditional environment, what do they say? Most cases, patients say they like it because they don't have to make an appointment. You just walk in. You can't go to your doctor's office now and say, hey, I need a vaccine. They won't even remember to tell you what kind of vaccine you need. It's not the top of their mind. But we pharmacists, we know that if I open my fridge for you and you can see it, I've got vaccines here, a whole lot that can take care of 500 patients right now of the flu that the government just sent me, as well as other vaccines I'm expecting. So there's no need for an appointment here. Also, patients experience shorter waiting times. We talked about this earlier. When you go to a doctor's office, you have to sit and wait and go through some processes. Here you don't. There's no wait time at all. The other thing, like I told you earlier, the government pays us for administration of vaccines. So patients really don't pay anything out of pocket when they come to us. It's either their insurance is paying or the government has a budget that pays for people that are not insured. Also, younger, healthier adults in particular, they also have lower immunization rates. My eldest son is 27. He's graduating master's in the next 2 weeks. Those boys are so busy, they are not concerned about these things. But We know that they're very active on their social media. Everything is on their handheld computer, handheld phone. Easily, we can provide convenience for them as they come in here, spend a few minutes talking to the pharmacists, educating them about the need for vaccines, and then we can administer those vaccines to them. Especially for young people, there's the human papillomavirus vaccine, HPV, that we give to young girls and to young boys as well. Of course, a pharmacist's expanded hours also translates directly to patients' increased access. So let's move very fast so we can finish this. Value of pharmacies continue. More pharmacies are offering vaccination services. I think we talked about that. We've talked about this now. Pharmacies are educated healthcare providers. We all have accreditation council for pharmacy education. We can maximize the use of pharmacists. Right now, in the PharmD curriculum in all pharmacy schools in America, there is a module for pharmacy-based immunization delivery. So by the time you're graduating out of college, you've already been taught and you have your certificate to issue. This is my certificate of achievement when I did my pharmacy-based immunization delivery certification. You can see how long ago that was. That was the year 2009. I've been vaccinating since then. Again, community pharmacists are important leaders when it comes to recommending and initiating vaccine programs. We provide up-to-date information about the importance of vaccines. We can screen patients as they come to us for missing or recommended immunization. With awareness among adults about needed vaccination lacking, we pharmacists are more than qualified to fill that need. We also have access to patient medication history. I'm sure pharmacies transitioning into that in Nigeria. I hardly have any paper here. Most of my records are kept electronically. So when a patient comes, I can pull up all their medication and all their history, and I can see where opportunities lie for them to get vaccination. An example is a soldier or a construction worker. And I look at him, I look at his history, he doesn't have a tetanus vaccine, I'll immediately recommend that and make sure that I give that to him. Another example is, let me say, somebody who works in a pet shop. He works in a veterinary doctor's office. They take care of dogs and pets, and this person doesn't or has never taken a rabies vaccine. I will recommend that immediately. Also, one thing we do is we can provide reminders for patients when they take vaccines. As you may not be able to see that on my card, the date I took my first is there. At the back, the date for the second vaccine is there. And we have it on our computer system too. Based on the day that they took it, we can tell them when is it that their next vaccine is due. Pharmacists are immunizers. In 86% of community pharmacies all around the US, we perform one or another type of vaccination. We're authorized in 50 states and 2 territories of the United States. I said earlier, every pharmacist needs the basic skill of immunization before they can qualify for a job at this time. We're underutilized still, but immunization services can help connect dots because we're a location for information about immunization as well as a place to receive immunization. In summary, pharmacists are in a unique and highly beneficial position when it comes to helping public health efforts aimed at closing the vaccination gap for adults. Pharmacists are easily accessible healthcare providers. Our training and certification provides us fully for participating in all aspects of community vaccination delivery. More importantly, we can readily connect the dots for patients, from education, advice, guidance, to providing the venue for and the administration of the important adult vaccination. So now we've got 300 million people in America. I think there's about 220, 230 people in Nigeria. And now there's a race to vaccinate everyone. Prior to the vaccine coming out, we had nothing that we could fight the coronavirus with. We were all looking at herd immunity. The vaccine is, the pandemic is still going on. Don't be deceived. The challenge is there worldwide, but pharmacies have been delivering important public health services for a long time. I mean, when I was in Nigeria, SFH was just coming through with birth control and everything to do with sexual reproduction. Pharmacies were part of that company. Some of those guys, I work with them. And pharmacies, we are already involved in vaccination. So why do we think pharmacies matter in mass immunization? This is when we have to define herd immunity. It's a term used to describe a population scale immunity barrier, which can be achieved when a threshold of the population acquires effective immunity by vaccination or natural infection to the pathogen, bacteria, or virus. In America, I think it's about 70 to 75%. When 70 to 75% of the people have become immune to the virus, either by way of vaccination or by natural infection, then the vaccine will eventually die out and fizzle out. So understanding how vaccination programs work in contextual immunity provides insight into potential national and global COVID-19 vaccination strategies. And pharmacies play a very significant role in this. Here is a picture of depicting what we mean by herd immunity. The red people here are the people that are contagious. The yellow people are people that are not immunized. The blue people are the people that are immunized. So when a virus or a disease comes, at the beginning, the disease spreads freely from contagious to susceptible people when no one is immunized. As you can see, there's a lot of red, it jumps into the yellows. So if some people are immunized, the disease will spread all through those, although those immunized are spared. So it's reducing the number of vectors it can jump to infect more people. Now, when more people are immunized, as we have in herd immunity here, you can see that the percentage of reds, or the number of reds, is now so reduced. There's not enough people it can jump to and infect. And this is why herd immunity is very important. And pharmacists play a lot of role in getting people from the red zone here where they're contagious or where they are susceptible, yellow, not immunized, to where they're blue, where everybody is immunized. And very quickly, we would have not a lot of people that the virus can jump from one to the other. We started really immunizing people a lot once our new president came. He promised that we would do 100 million vaccines in 100 days. Alas, we've done 100 million vaccines in 50 days. And the reason why we got to that is because all of a sudden they started utilizing community pharmacies to immunize people. And because of that, the COVID vaccine infectious rate has dropped by 67%, all within 2 months. And right now, we are actually immunizing over 2 million people a day in the US because pharmacies are playing a bigger role in the immunization process. Now, it is important that the government must consider various elements in its vaccination policy. I know in Nigeria, I think it's the Primary Healthcare Commission that seems to handle most of this. But some of the things they have to consider is estimated herd immunity threshold. What percentage of the people would they need to vaccinate to be able to attain herd immunity in that environment. What are the methods of vaccine delivery? Who are they using? Are they just going to use doctors alone? If they use doctors alone in Nigeria, it will take forever to get that done. There are more pharmacists. The access is easy. Vaccine cleaning locations, which may be pharmacies. And then what's the staffing arrangement and training and strategies for vaccine prioritization? As just like we do here, we do not open the door to everyone. We work in terms of prioritization. We started with healthcare workers because they're the one closest to the front line. Then we went on to people that are over, I will say 70 years old that live in long-term care facilities. And then we came down to 65 years old and above that have medical condition. As at this week in Texas now, we're vaccinating people 50 years and above. And I would think that in the next 2 weeks, we'd have dropped it down to 30 years and above before we start thinking, hey, the children need vaccinations or not. And pharmacists can and should play a key role in rollout of mass COVID-19 vaccinations. Now, community pharmacies are recognized as most access and most accessible health. Data shows that 95% of people living in the cities, even rural areas, are within 2.5 kilometers to a community pharmacy. We've talked about connecting public with health resources, particularly in rural and remote areas. If you go to all those villages in Nigeria, once you've left the city, once you've left Lagos, you've left Ibadan, you've left Port Harcourt, you've left the state capital. Typically, the concentration of any kind of healthcare practitioners is very minimal. I think you find more pharmacists than any other practitioners in those places. And that is why pharmacists being included in need for mass vaccination of the populace is very important. This is our COVID rollout strategy. We've started using pharmacies. We've trained providers. I did tell you earlier that supplies to help us administer vaccines safely, including PPE, equipment, all of those things are provided. We've trained people on vaccine storage and handling, vaccine transportation administration. And we also ensure that we have capabilities here to address adverse effects, including anaphylaxis. Before I start a vaccine clinic here, the first thing one of the first things I get is I have to get, we call it EpiPen, which is epinephrine. I think you guys call it adrenaline. It's just one shot you give somebody if all of a sudden they're having an anaphylactic reaction, and that wakes them up. And you can easily transport them to the hospital. Also here, I must tell you that vaccines are biologics, meaning you cannot give vaccine to anybody without a prescription. So vaccines too are prescriptions. And because of that, we're able to have collaborative agreement with physicians. My collaborating physician is actually 2 blocks away. He's one of my, I call him uncle because he's older than me. He's a Yoruba man. And I work with him very well. With opportunities like this, we can improve professional relationship amongst us. Because at this time, it's no longer about I'm encroaching in his field, he's encroaching in mine. No, because the government would hardly give him any vaccine, but they would give vaccine to me. And he would have to work with me in order to get his patients vaccinated, his office people vaccinated, even himself. And because of that, we continue to work on improving professional relationship. Also, we collect information system to support the vaccine rollout. The government help us really by sending email and text reminders to candidates that are due for vaccination. Also, our computer system is able to do that. We have a phased approach to COVID vaccination. I've said that earlier. We determine critical population phase approach of distribution. There's a whole lot of slides here that talk about vaccine handling and storage because it is so important. The integrity of your vaccine is only as good as to how well you adhere to storage and handling. I want to encourage us in Nigeria that I remember I was teaching a course to pharmacists here in the DFW only last week, Sunday. I was talking about best practices for healthcare professionals and COVID-19 vaccine. And I mentioned about the cold chain that it's possible too that in Nigeria, they could handle the Pfizer BioNTech vaccine, though it has to be stored at minus 60 to minus very, very cold, as well as the Moderna, which comes in at minus 20. And one of the things I did tell them was they should never underestimate the resolve of the government or the resolve of the practitioners in Nigeria, that our people are able to do whatever they set their mind to do. And truly, if the opportunity comes for us to have the Pfizer vaccine or the Moderna, we should take it, and we should work with the excursion opportunities that there are with these vaccines, so that we know that there's a central place where these vaccines are stored, where the cold chain is perfect. And we know that once you take this vaccine out of storage, you've got between so many hours to thaw it and administer all its content. We can schedule vaccine people, we can schedule people who will take the vaccine within that time, typically around that neighborhood where we're storing that facility, we're storing those vaccines. It may be a clinic on a Saturday that the government would decide to administer vaccines and involve pharmacists. It may be in Abuja. And all of the and what we do there is take it out of that storage unit, and then we've got how long the Moderna I think I have 6 hours from when I open each vial. If I don't open it, I have 12 hours. But if I open it, I have 6 hours from when I take it out of the fridge. So we can actually transfer that vaccine from a cold storage unit in Ikeja and go to our Limosho to go administer doses, because we've got that period of time. But during that time, we're transporting those things. We try to keep it close to the temperature it was even before that time. So my people in Nigeria, please be encouraged that these things might sound like it is in another country, another world entirely. But I believe seriously in the Nigerian and the ability within us to be able to do what we need to do to get things working. Now, the vaccine cold chain is very important. We say it's a temperature-controlled environment used to maintain and distribute vaccines in optimum condition. When I got the Moderna vaccine, it came here in a box from the manufacturer. It was packed in an ice container, and it came here at minus 20 degrees centigrade, even in that box. And there's an indicator that is attached to the box. Once I open it, I see it. Green to say it is still in good integrity, red to say it is not. I haven't known anyone who has gotten one that is red. Same thing with the Pfizer BioNTech vaccine. It requires very, very cold temperature. But these things come to us in packages with dry ice that it is already in there, stored for you. You can actually keep that vaccine in that dry ice for up to 5 days, during which time you're administering this thing. Once you take it out, I think you have about 2 hours or so within which you must administer all the vaccine. Some of the best practices we do is we know, for instance, in the Moderna vaccine, there are 10 doses in there. It's 5 ml bottle. Each dose is 0.5. And since I have 6 hours from when I open a vial, I want to make sure that every time I open a vial, I have at least 10 people that I have to give the vaccine to that is ready. I will probably not open a vial when I have only 5, because vaccines are very, very expensive. Vaccines are very important at the moment. We don't want to be wasting any vaccines. Right now in Nigeria, you've got the AstraZeneca, and it won't be wise for any practitioner to be throwing away doses when there are a ton of people that are still waiting to get vaccines. So the cold chain itself, it starts with the cold storage unit at the manufacturer through transport to distributors. I think the manufacturer, for instance, AstraZeneca comes all the way from the UK. Transport to distributors. Distributors will probably be the primary healthcare in Nigeria. And the vaccine centers will be the provider facility for Nigeria. All of this are part of the cold chain, and the cold chain ends with administration of the vaccine to the patient. During this process, all of that process, the vaccine must be stored in manufacturer recommended storage condition. This is a flow chart. You can see vaccine manufacture, you can see vaccine distribution, you can see vaccine arrival at provider facility, vaccine storage handling, you can see vaccine administration. You can see where it is the manufacturer responsibility, the manufacturer and distributor responsibility, and you can see from when it arrives at my store, at the provider, it is my responsibility to ensure that the cold chain is maintained.
Please, we have 5 minutes more.
Okay. So factors that affect the cold chain, as you can see, you need a well-trained staff, you need SOPs, we need to designate somebody as primary coordinator. These are some of the duties of a well-trained staff. You also need reliable storage and temperature monitoring equipment. Over here, people are very litigious, so we carry insurance policy to protect us for these things. There's temperature excursion, which I talked about earlier, moving it from one place to the other. It must still maintain manufacturers' guidance. We say vaccines are very expensive, so we need to unpack them as soon as they come into our stores. And we must account for every dose, whether they are administered, wasted, compromised, expired, or transferred. Now, for some of these vaccines that you may get, you might see beyond use date. Some of these beyond use date might be earlier than the expiration date on these vaccines. For instance, I've shown you this Moderna vaccine here. The expiration date on this vaccine, I think, I don't have the original box, but it's way, it's not today, not tomorrow, not a few months. But once I open the top here and I pierce this with a needle, then it has 6 hours beyond use date. So I can't use it past that. So be aware if you're giving vaccines and you see that. And of course, for any of us that is handling vaccines, we must have emergency vaccine storage and handling preparation. We must have notes. Where are we going to move vaccine to? If, for instance, there's power failure or system failure. Storing and handling, we must have all those SOPs written. And then the next, I think the last thing here is setting up vaccination clinics. Here are some of the things we need to be asking ourselves step by step. If you go through them, you will find that it's not different from what really a pharmacist will be asking himself on a day-to-day work schedule. You would obtain support, seek out community response, you assign tasks, plan workflow, determine who is responsible, and when you order vaccines. Mass vaccination is the same thing, but in this case, you're going to be working with a lot of people that are not pharmacists. They might be in operations, they might be in your local government area, but it is important that pharmacists be present. This is a picture of a mass vaccination center, and this was run by one of our NAPSA members in Ohio. You can see how people come in, they check them in, the seat is one person, everywhere is spaced out, everything is clean. We know how they're coming in, we know how they're going, we see where they dispose of used equipment. For an individual, if you're planning an event, these are the things you need to do. These are some of the supplies you might be needing for a vaccine clinic. At the end of the day, preparation is key. The things you need to do 3 to 6 months before the event, the things you need to complete 1 to 3 months, things you need to complete 1 to 2 weeks, things the day before the event. You need to do some checklists, conduct inventory that you have the exact quantity you need. The day of the event, you have to get there earlier, set up and be ready. Of course, I showed you what that looks like in the mass vaccination center, and some general best practices are listed here, some of which is to describe recommended practice and administration of vaccine. There's time and spacing of vaccine. There's vaccine administration. Is it PO? Is it subcutaneous, IM? The safe use of needles. What is the size of needle? How do you dispose of that? Storage, handling of vaccines, vaccination record, vaccination information source. How do you alleviate discomfort and pain? These are some of the pharmacy-based immunization, and these are some of our members of NAPSA, some of our Nigerian people. This is Nkechi Akiseyi. She's vaccinated out of our store at Plano Pharmacy here in Dallas. This is Akindele. He's also out of Plano Pharmacy, vaccinating people in store. This is a hospital-based team. You can see Dr. Teresa Pounds is here with a team of interns that are prepared and ready to start vaccinating. And this is yours truly in my store here as I give vaccination to people. So I want to thank you for your time listening to me this evening. It's been a pleasure. I hope that I've been able to highlight and show that pharmacists are an integral part of primary healthcare delivery around vaccination and immunization for our community. Thank you very much.
Wow, thank you very much, Dr. Kunle, for this mind-blowing presentation. It's been very practical, simple, and real. At this point, our time is fast spent, so we want to quickly welcome questions and comments. Brief, as we'll be rounding up in the next 13 minutes. So those who have comments, should please raise their hands. If your video is not on, kindly use your raise hand app for our presenter to take the questions. Okay, I think the first question or first contribution should come from Foluke. I see Foluke Akinri. Name is not complete there.
Okay, thank you everyone. Dr. Kunle, well presented.
Thank you.
Yeah, I'm a member of the American Pharmacists Association, and I'm aware all the things you said are on point. I'm a certified immunizer since 2016. And my question, without taking our time, is that I decided to return to Nigeria, you know, to affect our people here. And one or two questions that I want your personal opinion about is if someone takes a Pfizer vaccine and takes the first shot and then wants to take the second shot as AstraZeneca, what is your opinion? And then I noticed that you were careful not to mention pharmacy technicians as being integral to immunization in the US. Now, when do they need to be supervised by pharmacists, or do they have their own separate program for immunizing? So I'll just take those two so that other people can ask their questions. Thank you so much. Well presented, very down to earth and simple.
Thank you very much.
Thank you very much, Dr. Kule. Dr. Kule, please, a minute. I want you to take two persons at a time because of our time.
I might forget to. I'm not that brilliant.
Okay. Okay, you can go ahead, sir.
Okay, thank you. Thank you. I see my preceptor here, Mr. Ku. Good afternoon, sir. Having said that, Ms. Foluke, were you in Dallas by any time, if I remember?
No, well, the last assignment was in Nebraska.
Okay.
But Wisconsin and Georgia were my area of specialization.
Okay, that is good. That is good. Your first question is, I should address if there can be a cross vaccination of different vaccine choices. The first time he took Pfizer, the second time he took Moderna. I can tell you that there has not been any cross study combining both. All the studies that have been done have been basically with one vaccine. If you got the Pfizer first, you get the Pfizer the second. If you get the Moderna first, you get the Moderna the second. I would not be telling you the truth if I don't say that I've not heard that people took I know even physicians that took Pfizer first, and once the Johnson & Johnson came, knowing that that's just one shot, they just went ahead and took that and just forgot about everything. There really is no study comparing or monitoring or finding out if that is a practical thing to do. If there are any results to that, we don't know. But I will stand by the studies and say, please, if you got your Pfizer, please try and stay with the Pfizer. If you got Moderna, try and stay with Moderna. The second question was, I didn't mention pharmacy technicians. Yes, pharmacy technicians are integral to our work. When we appoint a point person in our vaccination programs in our pharmacies, it's typically a pharmacy technician, typically a lead pharmacy technician. That's the person who receives these vaccines, persons who checks them, pulls them, and prepares them until when the pharmacist decides that it is time to administer the vaccine. In some states, technicians are authorized actually to give vaccinations after adequate training, and they must be supervised. Thank you.
Thank you so much.
Thank you very much. I see the national chairman is raising his hand. I actually wanted him to have the last word, but the time is far gone. So I want the national chairman to speak now for to take other comments. Dr. Madu, please.
All right. Good evening, Dr. Ejiro. I believe I'm audible enough.
Loud and clear.
All right. I want to thank Dr. Tometi for honoring our invitation to present or lecture us about U.S. pharmacies as vaccination centers, a template for Nigeria in COVID-19 and at other times. Dr. Tometi, congratulations for this fantastic presentation tonight. I can see a lot of my senior fellows, my senior colleagues, and other persons around, including some members of the press and even physicians amongst us this night. All that CPAN does is about advancing patient care or advancing direct patient care through clinical pharmacy. And one part or the flesh in today's presentation is about it being a template for Nigeria, both at the time of the current pandemic and at other times. So I believe that as all of us work towards the betterment of our patients, we shall be borrowing things from the presentation tonight. I may want Dr. Kunle to explain something to me, please. He said, of course, all of us know that vaccines are prescription medicines. And he said that before you get your vaccine, you must get a prescription, so to say. I want to find out how feasible it has been, because you are saying that you can't be waiting for a physician to probably prescribe or immunize you for a period of 2 hours. You are giving it as an advantage of pharmacies to be used, since people don't need an appointment to go to pharmacies and get their vaccination shots. Now, does it mean that those people will need to go to their physician first, maybe spend hours, then before they come to the pharmacist just to collect the shot? So I believe, as we want to borrow from what you have taught us tonight, and as I know we have policymakers and other persons that may be called upon tomorrow to design this kind of templates for Nigeria. I can see members of the PCN, and I can see members or senior members of PSN too. You are a fellow at NAPSA. SIPAN is also collaborating with NAPSA. And all we are working at is to see how Nigerian patients can benefit just like the Americans, because we are envious of America. In America, the average life expectancy is about 98 years, whereas here in Nigeria, it's about 54, even less. So we will be toeing the line of America. And then we shall also want to make it easy for our people as they get immunizations. We know it's not all about COVID-19. It's also all about other vaccinations like rabies vaccine, as you have said, tetanus, toxoid, and the rest of them. So please, I want you to clarify on this area. Does it mean people need to go out to their physician after waiting about 2 hours just to get prescription before they now come to the pharmacist for their vaccination shots? Thank you very much.
Thank you very much for that question, my old boy, Joseph Madu. I had mentioned earlier about collaboration. When I said collaboration in vaccine delivery, what happens is a doctor and I will partner, and he and I would partner, is my partner, because if there are any adverse effects, a doctor is needed to facilitate the transfer and admission of the patient to the hospital. Also, I did say that vaccines are treated as biologics, and it needs a prescription for you to administer it. When I collaborate with a doctor in immunization delivery, it gives me the authority and the right to write those prescriptions in his name for everybody that walks in to my clinic, to my pharmacy. So once we have that that collaborative agreement put together, and for me, thank God, it's not just only in vaccinations that I've pursued collaborative practice. I've pursued collaborative practice in geriatric medicine, where I suggest and sometimes change the prescriptions for a patient based on the things and the data that I see, in agreement with the doctors in that practice that handle those patients. So bottom line is, yes, vaccines are biologics. They are under the supervision of the CDC, and they require a prescription for it to be issued. So everybody that gets a vaccine, actually, there's a prescription raised for them by the pharmacist based on collaborative agreement he has with the doctor for that particular service. Do I answer your question right?
Yes, thank you very much.
Thank you.
Thank you very much. The National Chairman, Dr. Madu, for that question. We'll be taking the two hands that have been on much earlier for want of time. That will be Chijoke and then Kai or Amy. Those are the names that have been on. I want to plead with I think Tony Doko will not be taking that. So please, the next question should come from Chijoke, and then we'll round up with Kai. The other questions.
Excuse me, Dr. Ejiro. Sorry, please. Please, personal privilege, please.
Okay.
Hello, Dr. Ejiro.
Okay, madam, here, sir.
Yes, please, you will permit Dr. Tony Doko to speak. He's the National Education, I think, Committee Chairman of the PCN. And you know, PCN, they are major stakeholders in whatever we do. So
of
please,
course.
Thank you very much.
With permission from the National Chairman, we'll be adding Dr. Tony Doko. Please, the names I'm pronouncing, pardon me for not properly recognizing. I'm just calling the names as they appear. So I may not know your appropriate titles. Pardon me for that. So please, let's listen to Chijoke now. Okay, it's like Chijoke is not online now.
You may need to unmute him or let him unmute himself.
He needs to unmute. I think. Okay.
He has the permission to unmute. He has the permission, please. You can go ahead.
Is he still online?
Hello.
Okay.
Hello, sir.
Yeah, we can hear you.
I actually have two questions. I actually have two questions. Though the other person has a question based on prescription to get the vaccines, but the question I have right now is that ideally both patients who are positive and negative to COVID-19, they all got vaccinated. Now, is there any data that have proved that people who have COVID-19 has actually been vaccinated and the COVID-19 has been cured? That is just my question, sir.
Let me try and rephrase your question for you so that we can move very fast. I think what you're trying to ask me is that is it possible that you can still contract COVID-19 after getting the vaccine? And if that is your question, I must tell you that there's no vaccine that is 100% perfect. Also, what the vaccine does for you, it only challenges your body to produce antibodies. So when you do get challenged with COVID-19, you are very likely not going to be ill, or you might just have mild symptoms. But chances of going to hospital and being admitted or dying is actually close to zero. You're not going to die, you're not going to fall critically ill because you've taken the vaccine, and the vaccine is going to help your body make antibodies. I hope that answers your question.
Okay, sir. Thanks, sir.
You're welcome.
Thank you very much, Dr. Kunle. Before we move on to the next question, I think somebody posted something on the chat. That will be, pardon me for the name, O12 posted that clinical findings have confirmed that 2 different brands of vaccines can be taken as first and second doses. No untoward effects have been observed. However, there's no reference added to that comment. It would be nice if we have at least one reference so the rest of us can look it up for that use. At this point, I'll plead with Kayode Ayegbajeje to that you will take the last question and you also give us our parting words. So please allow me to ask Dr. Tony Doku to give us the next question. Our last question will come from Kayode Ayegbajeje. So Dr. Tony Doku, please, you have the floor. And forgive my initial omission.
Thank you very much, Pharmacist Sedro. I also want to appreciate the chairman for giving me the opportunity. Let me start by thanking Dr. Tometi for the well-researched presentation. I think this is down to earth because it's something that we can easily apply in our own setup here. Mine is not really a question, but just something I picked from what was presented. And that is the fact that in the US today, he mentioned that as part of PharmD curriculum, that vaccination is part of the training that people get, and they are certificated. And that's the area I want to take it from, because I'm happy that we have some erudite scholars like Professor Femi Oyewo on this platform and some other policy makers. And I think that is where we need to be looking at. Like the chairman of CPAN said, I work with PCN and presently under the Education and Training Department. And I'm really going to take this up to see how we can have a policy direction that will help us to have this as part of our PharmD curriculum and its certification at the end of the day. Because in Nigeria here, we all know that certificates makes all the difference. And that is what the other health professionals have been using against us, saying that we can't do this because we are not trained for it. But this is one area that I can tell us that we are going to look at. I will take it up personally and then see how it can be, included in our curriculum and certificated for people to be able to use it to do vaccination in the country. Thank you very much.
Thank you very much, sir. And that is a great one. We look forward to achieving this. Before the last question, permit me to please recognize once again the following persons who are present with us. First, the CPAN VIPs, our national chairman at the National Expos, all the state coordinators and their team, fellows of the West African College and the Pharmaceutical Society, the director of pharmaceutical services, and all heads of departments of pharmacy here present, members of the academia, and especially I want to appreciate the presence of distinguished Professor Femi Oyewo. Thank you very much, Ma, for making this meeting. And indeed, I want to thank one and all who have been able to be here. So at this point, we want to call on the last speaker for tonight.
Yeah, thank you very much for this program tonight. I give kudos to the organizers and to Dr. Tometi. If you had performed less than what you did tonight, we'll take you back to General Hospital and spank you and put you on call for like 2 weeks. So I'm not really surprised that you come up with this. Unfortunately for us in Nigeria, healthcare professionals have become divided into us and them, we and they, and so on, such that it's like kind of a war. Just 2 weeks ago on Channels TV, we have the Secretary of NMA saying that what do pharmacists know about injections? What do they know about vaccination? And if something happens, can they handle it? Well, just to be fair, I know in the US, you have excellent ambulance services and you get quick healthcare and you handle emergencies extremely well. And that in Nigeria, even if ambulance response, traffics now in Lagos, for instance, can make a journey back to base very difficult for ambulances. So now, what will you advise for us? And then when the training is designed, that when extreme reactions occur, like anaphylactic reactions and emergencies, how are we going to handle that? I know it's going to be part of the training, but in view of the kind of situation that we have, ambulance services and emergency places where things like that could be had, because we cannot alone, even a doctor alone cannot handle serious emergencies, so that you need ambulance to take to a very big facility to handle such. What will you advise for us to do? And then in handling challenges like this, that comments, negative comments coming and sniding us and putting us down, how do you want us to react to that? Thank you very much once again, and thanks to the organizers.
Thank you very much, sir. I remain highly loyal for your tutelage and encouragement in days past at General Hospital, Lagos. I was born at the Island Maternity, and walking across under your tutelage, because you were young like me then, it really shaped my life and the way I went with pharmacy practice. Also to thank my professor, the chairman of the board of fellows. I thank you, ma'am, for all that you've done for us. Now, let me answer your questions in many parts. The first one is you talked about practitioners are now us and them. And as such, I'm reading what my co-chair, Mrs. B.C. Bright, also wrote, that it is in fact the key point, the most important thing here in vaccine administration. You can administer vaccines without collaborative agreement. I have thought about the Nigerian situation and I wonder, how do we start that? I tell you, here in Dallas, Texas, the Great Ife Alumni Association, for which I am one of the organizers and one of the top participating members, have over 150 members. Of those 150 members, 5 of us are pharmacists, and about 8 of those members are doctors. Most of them, I knew them in Ife. I think in building collaborative practice, you probably have to start with relationship that you've built outside of the workplace. You have to meet people in their place of comfort. You have to meet your friend who is a doctor, your friend that when you meet, you're probably not discussing medicine and pharmacy acrimony. You're probably talking about children getting married, children going to college. You're discussing all those things, whereas you're also trying to cultivate and put in a need for collaborative experience. I'm sure there are people amongst the doctors, the dentists, and all those people you work with that you probably went to college with, or you are at the Ikoyi club or one of those golf clubs or one of those churches that you attend, that you are with them. You have to carry this conversation of collaborative agreement away from the practice environment and take it to a personal level. The doctor that is my collaborative practice doctor here, I don't have any need for him on a professional level. Rather, he and I is the oldest of all the Nigerian doctors around here. As such, he's also a Yoruba man. I can't even call him by his name. I have to prostrate to almost greet him. because I show him that much respect outside of the professional practice, he's more than ready to work with me in anything I want in collaborative practice. Yes, there's been a lot of bickering among pharmacists. Over here, collaborative practice is being promoted. It is in fact a demand in some areas where you work, like the hospital. You can't go rounding without a pharmacist. Pharmacists have authority to change prescriptions as and well due. I remember when I interned in a hospital last year, we were doing antimicrobial stewardship. We would change a patient from vancomycin after 24 hours, based again on collaborative practice with the people in the lab. They send us the lab, the sensitivity testing. If the bacteria is sensitive to something lower in the rank of antibacterial, we quickly change it from injectable to oral. Just doing that in a year saved that hospital more than $500,000 in cost of antibiotics. So collaborative practice is very important. Only yesterday in this practice, I had a patient who will always, I got the patient from another pharmacy. She will get 5 canisters of what you call Ventolin inhaler every 60 days, every 90 days. And as a clinical pharmacist, I kicked against that. There's no need for a patient to be using that much rescue inhaler in such a short time. I called the doctor's office. I educated the doctor on the need for orally inhaled corticosteroids. I educated the doctor on the need of antihistamines. And by the time we were done, we have the patient now on Advil. We have the patient on Montelukast. We have the patient on cetirizine. And I can assure myself, and I told that doctor, that that patient will not be needing Ventolin in the next 180 days to 1 year, because now you are probably focusing on the disease state. And that is the way we can begin to get collaborative practice, by showing your value to these practitioners. Once they can qualify and quantify that, you will get your respect. Doctors call me here all the time because, of course, I've shown my mettle in being valuable, in helping their patients get better, in being valuable in saving their patients money. And these things are so important. It's that we have to take this conversation away from the professional table and take it to a personal relationship level. The second question you asked was about handling emergencies. Yes, some of the list of items we have to have in order to have a COVID clinic will be things we'll use to treat anaphylactic shock. We have simple things, even like diphenhydramine, which is Benadryl. You need to give people some, and you hardly even get a patient experiencing those, because the questionnaire you ask them before you qualify them to take a vaccine is so long that when you review that with them, if you have a concern, you will not give them a vaccine. If a patient comes to me right now and the patient tells me that they've had allergic reaction to polyethylene glycol, Miralax, that stuff we use for a laxative, I will not be giving them any of the mRNA vaccine because it's contraindicated. If a patient tells me they have allergy to eggs, I will not be giving them the flu vaccine. So there is a lot of interview you have to do with the patient in order for you to come to a decision that yes, you need to be able to vaccinate the patient. But we must continue to work to collaborate with our partners, the physicians, the lab people. The lab people are so vital if you are an infectious disease pharmacist, even if you are a nephrology pharmacist, if you are, for instance, you are an oncology pharmacist, the radiology technician is so valuable, very important. All of these people play a role. As long as we were able to show our value, hopefully we can get improvement in collaboration. And I thank you.
Thank you very much, sir. Just to also add to the comments, the remark by the supposed enemy scribe that what do pharmacists know about injections that they want to vaccinate. It's just being mischievous, because vaccination in Nigeria, we all know, is mainly handled by community health extension workers, not even the doctors. So for him to be believing that community health extension workers know more than pharmacists is just being mischievous. We do know, and it is obvious, that with pharmacists, vaccination programs will become more successful, as the US experience have shown. Dr. Kunle rightly mentioned, collaboration is the key. And one champion of collaborative care in Nigeria, our most senior elder pharmacist, Folashade Lawal, can attest to that. I think I saw her comment clearly stating that she's a frontliner in collaborative care. So once again, thank you very much, Dr. Kunle, for this wonderful presentation. And I want to also thank the national chairman for making this a reality. And together with Dr. Tony Doku, I'm very sure that the question of vaccination being part of the curriculum and pharmacists being certified will become a reality. I want to apologize profusely to my senior elders and professional colleagues here present, whom I may not have been aware of their presence and appropriate recognition. Please forgive me. From the videos here, the names are just written there, and we're informed that there are members of the press and non-pharmacists present, so I couldn't really call everybody by name. Pharmacists, those that I am not familiar with. One good thing that came with the COVID, even though the COVID was a pandemic, was the exposure that younger pharmacists like us have gotten through avenues like this. We now realize that we are not as hopeless as we were thinking. There are actually very distinguished, achieved senior colleagues that we can look up to and do more. So we now see that there is hope for the profession in Nigeria. At this point, I want to call on Pharmacist Kayode Ayegbajeje for the vote of thanks, like I mentioned earlier.
Is it okay if I say a few thanks to some of the people that work with me on this project? There's my classmate and brilliant pharmacist out in the UK, pharmacist Oyekunle Onifade. I have 3 interns that work with me here. I never work without a Nigerian foreign trained pharmacist as intern. They are excellent, and I take a responsibility of mine to show them the pathway in America. Chudi is here. I have the 2 interns, Miss Victoria and Miss Deidre out of Mercer University. I have Miss Morgan out of my new alma mater, Hookup Howard University College of Pharmacy. And I want to thank all of these people openly for all the work that they put through and the study they put up for me. Thank you.
Well, thank you, Dr. Tometi. I'm surprised we are to be thanking you, and you are the one thanking us again. I know the kind of person you are. I know you so much. And not surprised, you are just being yourself. You've never acted like somebody else, ever, never. Well, first I should just thank the organizers for this, and then for choosing the right person to come and give experiences. It wasn't delivering a lecture. He was discussing. So we were all relaxed, and he wasn't even talking to his slide. He was talking to us from experience. And that makes it so very, very enjoyable and educative. And it's so highly qualitative. And the slides are also reminders for us. We're going to get these copies, I'm very sure, for those of us who participate, or it will be shared on various WhatsApp groups or whatever. So I first thank the organizers, and I thank Dr. Tometi immensely well. And I'm very grateful for this highly qualitative lecture. We hope that in future, thanks to Zoom now, and thanks to the disruptions caused by the pandemic, there's always something good from something bad. And so we're grateful for this. People were shy of using Skype before. And then even when you use it, it's not as good as Zoom now, that we can see ourselves and in many of us together, and having a real meeting as if it's a virtual meeting as if it's real. So we'll be using you, so to speak, in many areas. Hospital pharmacies will be dragging you very soon. Community pharmacies will be dragging you very soon. PSN, Lagos State for sure. I'm sure National will find a way also of engaging you, either in lectures like this or for advices. And then when we face government, or when we have issues and we need policies to be formed, your inputs will always be welcome. Thank God you're already part of PSN Governing Council. So thank you once again. Have a very pleasant evening. In Nigeria it's already evening. I don't know. I think it's still daytime, afternoon in your place. So enjoy your day. Thanks very much.
Thank you, sir.
Thank you very much, sir. Dr. Peter Alphonsus, are you with us?
Yes, I'm with you.
Okay, please, you say the closing prayer.
Okay, can we hear me?
Loud and clear.
Okay. On behalf of the national chairman and all the ESCOs of CPAN and every pharmacist, clinical pharmacist that mean well for this country, we want to pray. Father, Lord, Heavenly King of Glory, we thank you for a special day like this. We thank you, Father, King of Glory, because we have always done everything we can do humanly possible to drive clinical pharmacy forward and drive patient care forward in Nigeria. We thank you, Father, King of Glory, for providing collaborators, our professional colleagues in the diaspora, that have actually come to intervene and to share their best practices to us. We equally thank you, Father, for the fact that aside pharmacists, we equally have other stakeholders that are Nigerians that can see clear that pharmacists are actually valued care providers. And pharmacists are an integral part of the healthcare system that can advance Nigeria forward and patient care forward. We pray that all we have done today, Father, King of Glory, you bless and you make them come into perfection and come into reality. In Jesus' mighty name we pray. Amen.
Amen.
Thank you very much.
Thank you very much, Kule.
Thank you very much.
Thank you, man.
Thank you very much, Kule. I wouldn't have missed this for anything.
Oh,
I am so proud of you.
Thank you. I'm so proud of
student.
you. Thank you. God bless you.
Thank you. Thank you, Kule. See you.
Thank you.
Take care. Take care of yourself. Bye.
Good night, everyone.
God bless you, ma, for always staying up for us. Good night, bro.
God bless you, sir.
Thank you. Good night.
Amen. God bless you too.
This has been a wonderful session. Yeah. Thank you, everyone.
Please repeat this.
Thank you, ma, for always staying up for us.
Thank you, everybody.
Thank you, Dr. Timipre. Education care is moving forward. The education committee is progressing.
Yes.
Thanks to everyone.
Well done. It's a good one.
Thank you.
Thank you.
Thank you. Merci
We've
beaucoup.
learned a lot tonight.
Yes, thank you, Dr. Bello, even though you don't speak.
Yes, so Dr. Bello, thank you so much.
Thank you, Dr. Alphonsus, for those wonderful words.
Oh, really?
Yeah, yeah.
We don't
Yeah.
used to hear his voice, but we always see the handwork.
Okay,
Thank you, sir.